Hello, and welcome to our channel. My name is Umair Malik, and I'll be your narrator today. But before we get into today's story, please do check down below that you subscribe the channel for more content like this. It's 100% free. Recognizing the silent signs. When time becomes precious, have you noticed subtle but concerning changes in an elderly loved one over the past year? Many people assume that death and old age happen suddenly, but the reality is far more nuanced. The human body often sends quiet warnings months, sometimes even a full year, before life reaches its final stage. Unfortunately, most families miss these crucial signals because they initially appear insignificant. It's typically only in retrospect that loved ones realize the clues were present all along. By then, the precious opportunity to prepare emotionally, make meaningful memories, and ensure proper care has diminished. In this comprehensive guide, we'll explore 5 critical indicators that frequently appear in the year before an elderly person passes away. Some might be changes you've already observed but dismissed as normal aging. Others might seem minor but actually signify the body's gradual transition toward its final chapter. Recognizing these signs early provides you with an invaluable gift: the opportunity to provide enhanced care, cherish meaningful moments, and ensure your loved one's final stage of life is filled with comfort, dignity, and peace. Understanding what's happening means you won't be caught unprepared. Instead, you'll be equipped to make the most of remaining time with those you cherish. Significant weight loss. The body's quiet retreat, one of the earliest and most telling signs that someone may be approaching their final year, is unintentional weight loss. Initially, the changes might appear subtle: a belt that suddenly needs tightening, clothes that hang more loosely, or a previously hearty appetite that gradually diminishes. Many families dismiss these changes as simply part of aging, but unintentional weight loss rarely signals something positive. It often indicates that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing at an accelerated rate, and essential systems are beginning to slow down. While aging naturally leads to some muscle loss, when it occurs too rapidly, it suggests deeper physiological changes. The body may be struggling to digest food properly, or the person might no longer process protein effectively, resulting in muscle wasting. This progressive loss of strength doesn't merely make movement more difficult. It increases fall risk, weakens immune response, and leaves the individual vulnerable to infections and complications. Another significant factor contributing to weight loss in life's final year involves appetite changes. Many elderly individuals experience diminished hunger sensations. Their sense of taste often fades. Food no longer provides the same enjoyment, and they might begin skipping meals or consuming noticeably smaller portions. This isn't merely preference. It's a physiological change as the body, sensing its gradual decline, no longer signals the brain to seek nourishment as frequently. The consequences include diminished energy, reduced strength, and an overall decline in health. Underlying medical conditions frequently play a crucial role in this weight loss pattern. Chronic diseases like cancer, heart failure, kidney disease, or liver dysfunction can progress substantially before more obvious symptoms manifest. Even conditions like depression or cognitive decline can lead to reduced nutritional intake, creating a downward spiral where the body receives insufficient fuel to maintain itself properly. Some concerned families attempt to address the problem by encouraging their loved ones to eat more, offering favorite foods, or supplementing nutrition with protein drinks and supplements. However, if weight continues dropping despite these interventions, it's important to recognize that the issue extends beyond diet. It's the body preparing for a deeper transition. At this stage, forcing large meals may cause discomfort rather than help. Instead, focusing on comfort, easily digestible foods, proper hydration, and small, frequent offerings can make a meaningful difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially when accompanied by decreased appetite, increased weakness, or diminished activity levels, it's time to pay careful attention. This isn't merely about physical appearance. It's about understanding the body's message and preparing for the journey ahead with clarity, compassion, and the determination to make every remaining moment meaningful. Profound fatigue and progressive weakness. Energy's slow retreat among the most noticeable changes in the year preceding life's end is a deep, persistent fatigue that rest doesn't alleviate. This isn't the typical tiredness following a busy day. It's a profound exhaustion that transforms even simple tasks into overwhelming challenges. Getting out of bed becomes difficult. Walking short distances requires considerable effort, and activities that once seemed routine, cooking, dressing, or even maintaining conversations begin to feel extraordinarily draining. This isn't simply a manifestation of aging, but rather a sign that the body is conserving its dwindling energy reserves. As organ function gradually diminishes, the body begins prioritizing essential systems. The heart no longer pumps as efficiently, circulation weakens, and muscles receive less oxygen than before. This explains why many elderly individuals in their final months feel increasingly weak, unsteady, and unable to sustain their previous activity levels. Metabolic slowdown represents another critical factor. While the body is designed to produce and utilize energy efficiently, during its final phase, energy allocation shifts dramatically. Instead of fueling movement and activity, the body redirects resources toward preservation of core functions. This explains why someone in decline may require more sleep, take longer daytime naps, and find it increasingly difficult to remain awake for extended periods. Some individuals experience sudden energy fluctuations, seeming relatively alert one moment but completely exhausted the next. Perhaps the most emotionally challenging aspect of this process is the psychological impact of increasing fatigue. Seniors who once took immense pride in their independence often experience frustration or embarrassment when they can no longer manage tasks they previously handled with ease. They may gradually withdraw from conversations, avoid social interactions, or abandon cherished hobbies, not from lack of interest, but from profound energy depletion. This frequently initiates a cycle of isolation where the person eventually stops attempting engagement altogether, which unfortunately accelerates their physical and emotional decline. For families observing a loved one transition from active and engaged to exhausted and withdrawn, the experience can be deeply painful. It's tempting to assume they're simply not trying hard enough, or that they should push through their fatigue. However, the reality is that forcing activity rarely helps and may actually increase discomfort. What matters most is understanding their changing limitations, allowing necessary rest periods, and making their remaining time as comfortable and peaceful as possible. When you notice a loved one experiencing deep, persistent fatigue unrelieved by rest, recognize it as a significant indication that their body is undergoing a major transition. This represents the time to treasure conversations, create peaceful moments, and provide support without expectations or pressure. In life's final chapter, what ultimately matters isn't how much they can accomplish, but rather that they feel genuinely loved, deeply understood, and completely at ease. If you're still reading and finding these insights valuable, please take a moment to reflect on how this information might help you support someone in your life. Your awareness and compassionate understanding can make an immeasurable difference during this sensitive time. Increasing cognitive confusion and social withdrawal as a person approaches life's final stage, some of the most noticeable changes appear in their cognitive function and social interactions. You may observe that someone previously sharp and engaged begins forgetting things more frequently, struggles to follow conversations, or becomes disoriented even in familiar environments. They might repeat themselves, forget names of close family members, or lose track of time and dates, even when they never experienced significant memory issues before. These subtle cognitive changes can emerge months or even a full year before death. This isn't ordinary forgetfulness. The brain, like all organs, requires consistent oxygen and nutrients to function optimally. As circulation weakens and oxygen delivery decreases, cognitive function inevitably declines. The person may become increasingly confused, experience difficulty making even simple decisions, or struggle to recognize people and places they've known for decades. Some individuals experience fluctuating lucidity, brief periods of clarity followed by episodes of profound confusion, almost as if their consciousness is gradually fading in and out of focus. Emotional withdrawal represents another common indicator. Someone approaching life's end often loses interest in social engagement. You might notice them speaking less frequently, engaging minimally in conversations, or spending extended periods sitting quietly. This doesn't mean they no longer care about their loved ones. Rather, their brain no longer processes emotions and social interactions as it once did. Conversations become increasingly taxing, stimulating environments feel overwhelming, and eventually, many seniors retreat into their internal world. Changes in mood and behavior frequently accompany cognitive decline. Some individuals become uncharacteristically irritable, anxious, or easily frustrated. Others appear unusually detached, calm, or indifferent to situations that previously mattered deeply to them. This isn't simply a personality change. It often results from the brain adjusting to the body's progressive decline. As cognitive function diminishes, emotions become increasingly difficult to express, and the person may respond to circumstances in unfamiliar ways. For family members, this particular stage often proves especially challenging. Watching a loved one lose connection with reality or withdraw emotionally can feel like losing them while they're still physically present. However, it's crucial to remember that these changes aren't within their control. Rather than attempting to force them back into conventional interactions, the most supportive approach involves meeting them where they are, speaking gently, offering reassurance, and understanding that even when they don't respond verbally, they can still sense your loving presence. If you notice a loved one becoming increasingly forgetful, confused, or socially withdrawn, don't dismiss these changes. These often represent early indicators that both mind and body are preparing for their final transition. This is a time for exceptional patience, cherishing quiet moments together, and creating an environment of safety, familiarity, and peace. Because even when words and recognition fade, the comfort of loving presence can still be deeply felt. Frequent infections and diminished healing capacity as the body begins its gradual decline. One of the most reliable physical indicators is a compromised immune system. You might notice someone who rarely became ill previously now seems susceptible to every passing virus, bacteria, or infection. What once manifested as minor illnesses now require significantly longer recovery periods, and simple wounds like small cuts, bruises, or skin tears heal at a noticeably slower rate. These changes aren't coincidental. They signal that the body can no longer defend and repair itself efficiently. One particular concern involves recurring infections. Pneumonia, urinary tract infections, skin infections, and oral infections become increasingly common as immune function deteriorates. Many families initially view these as isolated incidents, but when they occur with increasing frequency or require longer treatment periods, they often indicate the body's diminishing ability to fight pathogens. Even antibiotics that previously worked quickly may seem less effective, necessitating stronger medications, extended recovery periods, or multiple treatment courses for infections that once resolved easily. This happens because as circulation slows and organ function declines, the body responds less effectively to therapeutic interventions. Medications don't distribute as efficiently through the system, and cellular repair mechanisms function at diminished capacity. The healing process that once happened automatically now requires significant energy the body increasingly cannot spare. Chronic wound healing represents another frequently overlooked indicator. When small scratches, pressure sores, or bruises heal poorly or repeatedly reopen, it suggests compromised circulation. Inadequate blood flow means oxygen and nutrients don't reach skin and tissues efficiently, dramatically slowing the healing process. Pressure sores become particularly problematic for those with reduced mobility and can lead to serious infections if not carefully managed. What's particularly challenging for caregivers is that infections in life's final year often present atypically. Instead of developing high fevers, elderly individuals might simply appear more fatigued, confused, or less interested in eating. In fact, for many seniors, sudden mental status changes often represent the first warning sign of infection, even before more traditional symptoms emerge. This explains why recognizing these subtle shifts early can significantly impact comfort levels during this vulnerable period. For families witnessing a loved one experience repeated infections, the situation can feel both frustrating and heartbreaking. There's a natural inclination to pursue aggressive treatments, hoping that one more antibiotic course or hospital admission might resolve the underlying problem. However, at a certain point, the focus often necessarily shifts from curative approaches to comfort measures. Ensuring proper hydration, maintaining skin integrity through careful cleaning and moisturizing, and minimizing physical stress often contribute more to overall well-being than treatments that might prolong suffering without improving quality of life. If you're still engaged with this information and finding it valuable, please take a moment to consider how understanding these patterns might help you provide better support for someone in your care. Recognizing these signs early can make an immeasurable difference in their comfort and dignity. Significant changes in breathing patterns and circulation among the most definitive signs that the body is preparing for its final transition are noticeable alterations in breathing patterns and circulatory function. You may observe that your loved one breathes more slowly or shallowly than before. At times, they might pause briefly between breaths, or their breathing rhythm might become irregular, alternating between rapid and slow patterns unpredictably. Some individuals develop a distinctive breathing pattern called Cheyne-Stokes respiration, characterized by rhythmic alternation between deep, rapid breaths, and extended pauses where breathing seemingly stops momentarily. These changes typically begin subtly but become more pronounced and frequent as time progresses. Circulation changes represent equally important indicators. You might notice that extremities, hands, feet, earlobes, or nose feel unusually cold to touch despite normal room temperature. The skin may appear pale, develop a bluish tinge, cyanosis, or show mottled patterns, particularly around fingers and toes. These changes occur because the body prioritizes blood flow to vital organs, reducing circulation to peripheral areas. This represents a clear indication that cardiac output is decreasing and the heart cannot maintain normal circulation patterns. Many elderly individuals also experience increasing shortness of breath, even with minimal exertion. Simply sitting upright, speaking a few sentences, or changing positions might cause noticeable breathlessness. You may observe them breathing through their mouth more frequently or needing to pause mid-conversation to catch their breath. Someone who previously moved around the house independently might now struggle with even short distances, suggesting declining pulmonary function. In some cases, fluid accumulation in the lungs makes breathing increasingly labored. This can manifest as a persistent cough, audible gurgling sounds during respiration, or sensations of chest tightness. Many caregivers initially mistake these symptoms for temporary congestion from minor respiratory infections, but in elderly individuals approaching life's end, they often signal progressive cardiac or respiratory weakness. This can make lying flat extremely uncomfortable, leading many to prefer sleeping in upright positions, propped on multiple pillows or in recliners, to ease breathing difficulties. For family members witnessing these changes, the experience can be frightening and distressing. The natural response is wanting to help, encouraging deeper breathing, seeking medical intervention, or worrying that something urgent requires immediate attention. However, in many cases, these changes represent the body's natural progression toward its final phase. While there may not always be ways to reverse these physiological shifts, there are numerous approaches to enhance comfort. Maintaining comfortable room temperature, using humidifiers to ease respiratory irritation, offering small sips of water to prevent mouth dryness, and providing reassuring presence can significantly reduce discomfort. In some situations, prescribed medications or supplemental oxygen therapy may provide symptom relief, but the primary focus increasingly shifts toward comfort rather than attempting to reverse the underlying process. When you notice these indicators, altered breathing patterns, cold extremities, or skin color changes, pay careful attention. These frequently signal that the body is conserving energy and circulation is progressively slowing. This represents a time to be fully present, offer calm reassurance, and create a peaceful environment where your loved one feels safe and supported. During these final months or weeks, the most valuable gift isn't necessarily medical intervention, but rather comfort, dignity, and the assurance that they aren't facing this journey alone. Final reflections. Embracing the journey with compassion. As we conclude this discussion, take a moment to reflect on what we've explored. Significant weight loss, profound fatigue, cognitive changes, recurrent infections, and alterations in breathing and circulation. These 5 indicators frequently emerge during the year preceding an elderly person's passing. They rarely appear simultaneously or dramatically. Instead, they often develop gradually, sometimes almost imperceptibly at first. However, when you begin noticing these patterns, they signal that the body is preparing for its final transition. For many families, accepting these changes proves enormously difficult. There's a powerful instinct to resist them, encouraging loved ones to eat more, move more frequently, or somehow overcome their exhaustion through determination. Yet sometimes the most compassionate response involves listening attentively to what their body is communicating rather than fighting against natural processes. Instead of focusing exclusively on reversing inevitable changes, we can direct our energy toward making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death or surrendering hope. It's about preparing realistically for what lies ahead. When you recognize these changes early, you can provide more appropriate care, make important decisions thoughtfully rather than in crisis, and ensure that your loved one's final chapter includes dignity, comfort, and meaningful connection. This represents a precious time for sharing stories, expressing appreciation, resolving unfinished emotional business, and ensuring they know how deeply they are valued and loved. It's about creating an environment where they feel secure, respected, and never alone during this profound transition. If you're currently noticing these signs in someone close to you, Take a deep breath and remember you aren't walking this path alone. Countless families have navigated this journey before you. While never easy, understanding what to expect can help you find strength, patience, and a measure of peace amid the challenges. Remember that professional support is available through hospice and palliative care services, which can provide invaluable guidance, practical assistance, and emotional support during this sensitive time. These specialized teams understand the unique needs of both the dying person and their loving caregivers. Most importantly, be gentle with yourself throughout this process. Caring for someone in their final stage of life represents both a profound honor and an emotional challenge. Allow yourself to feel whatever emotions arise: grief, frustration, fear, even occasional relief, without judgment. Your presence and compassion matter immensely, even when the journey feels overwhelming. Thank you for taking the time to explore this important topic. We hope this information helps you navigate this sacred transition with greater understanding and preparedness. If you found this guide helpful, please consider sharing it with others who might benefit from this knowledge. Your support enables us to continue creating meaningful content that informs, comforts, and connects our community. Remember that recognizing these signs doesn't diminish hope. Rather, it allows us to make the most of precious time and ensure that life's final chapter unfolds with the dignity, comfort, and love that everyone deserves.